Good morning, everyone. Welcome to the HealthDeliver Clinic. So my name is Rob. I have a foot in international schools here in Thailand with ISB, and I also and working with HealthDeliver on their client solutions. So that's really understanding how the resources that Dean and HealthDeliver have built up can really serve certain industries such as international school. So everyone here today, you're either a parent of a child in international school, or you work in international school, or you work with a lot of stakeholders, employees who might be looking for an international school or have kids at an international school. So what we're here to talk today is really about ADHD, which has really become a big issue, especially since some of you might have realized since COVID, and you know how it is affecting students here in Thailand in the international school system. So really today we're here to hear from the experts. So we have two experts here today, Dr. Pim and Dr. J. I'm going to hand over to them now to talk a little bit about themselves, where they went to school. Some of these names might be familiar to you if you work in international schools in Thailand. And a bit about some of the work that they currently are doing. So maybe actually Dr. Pim, I can start with you.
Okay, so hello everyone, my name is Dr. Pim. So I studied here in KIS International School and also later in Concordian. So after I finished, I went overseas to New Zealand, and my first degree is in psychology. So I did that for about 4 years. Initially I wanted to enter like counseling, like school counseling and stuff. But after studying and working a little bit, I changed my mind. I switched to medicine, and I did this in Poland for a few years, came back to Thailand, got the license. I did freelance GP for like a year, and then I went to station in Hua Hin, and there I worked like a family care practice. So we're dealing with like expats who are retired and like have moved to Thailand. So expats from everywhere, basically Europe, Australia, New Zealand, American, Canadian, everything. And it's like a family care practice. So my patients are from like babies, like months, up until, I don't know, 80, 90 years old. So quite familiar with the culture from different countries, different aspects, and different ages. Also, I have an interest in like psychiatry. So I do have a little bit of extra training in that area. So when I was in Hua Hin, I was the main doctor who was responsible in this area. So we deal with stuff with like depression, mental health, anxiety, those kind of things. Yes, so that's like my background.
All right. Hi, I'm Dr. J, and I'm from Bangkok, Thailand. Here I started off in Thai school, then I moved to EIS for a year, and then I then went to NEST and graduated from NEST. After high school, I did all my higher education in the United States. I went to University of Oregon and I studied psychology there. Then I got my master in clinical psychology with an emphasis in marriage and family therapy from Pepperdine University. Then I got my doctorate degree in clinical psychology, specialized in neuropsychology from American School of Professional Psychology. After all my education, I did board certified, so I got licensed in Virginia. I practiced there for about 5 years and decided to move back to Bangkok earlier this year, and here I am today. So mainly with the work that I do in the state, I primarily provide psychotherapy. I do assessment for those who have neurological related disorders or psychological issues, behavioral issues. For evaluation, I started doing evaluation for children aged from 6 years all the way to older adults. And for therapy, I provide therapy for individual, for couples, and for family. And see various issues, type of issues, disorders. I work with the veterans who experience PTSD, anxiety, depression. Yeah, so basically any psychological issues, and also individuals who deal with any medical, neurological related, or any other medical issues that impact their psychological well-being.
Okay, thank you. Just one question for Dr. Pim. So, I mean, you've spent some time abroad. You've obviously been back in Thailand. You've consulted with, Thai patients, expat patients here on holiday. That time you spent abroad, how do you think it has helped you with the international market here, and how does that differ maybe sometimes from seeing, say, like a Thai patient?
Well, in many different ways, actually. Like one of them is like cultural side, so that's quite obvious. Like Western society and Thai society, the perception in medicine is quite different. Even the way medicine is prescribed or many things. The other thing is about the disease-related stuff. So like, I'm not sure if you're aware, but like Western disease and Thai disease are completely different. Like in Thailand, there's like parasites and dengue and stuff. I didn't study any of those back in Europe. When I returned, I was like, oh my goodness, what's this? Like, And yeah, and my professor was asking some question, and I was answering the question in a Western mindset because I studied in Poland, right? And my professor was like, why are you thinking of those diseases? They're so rare. So yeah, that's something.
Interesting. Okay. And Dr. J, I mean, psychology in the US, it seems to, the US as a sort of society seems to be a lot more open and maybe advanced when it comes to this kind of thing. Have you found any big differences between the work you're doing here than in the US?
Yes. So over there, pretty much like you said, they're more open, and topic about mental health is discussed a lot more. So parents and individuals as a whole, they are more aware, but not to say that they're not aware here. But I think there's this taboo and still like the culture where you don't really talk about it, and it's not really okay to talk, or they may not want to like seek help just because they don't want to be known that they're seeing, like, let's say, a psychologist, mental health professional. But yeah, I'm glad to see that these days they're a lot more open, and symptoms are similar. I mean, they may present or manifest in a different way, but having that experience working abroad as well kind of helped me understand and can kind of compare and see, like, okay, how to talk to the parents or how to talk to the individuals. And being Thai, I think knowing this culture can also help like relate to some of the people here too.
Yeah, I think today is also about fostering open communication between schools, parents, and obviously the experts here. So I think having that openness is important, and I think that's what we're trying to do here today. So today we're really here to talk about ADHD. So perhaps Dr. J, maybe you can just give us, so we're all on the same page, an overview of this condition, how many people it affects, and when we might start to notice it, and in what way.
Sure. So first of all, I want to say like ADHD is a brain disorder. So it affects like the frontal lobe area, which functions in executive function, inhibition, concentration, and focus, right? So those who have ADHD will have difficulties in these areas. In addition to that, it also does something with the neural transmitter, the dopamine, which also deals with these areas, these functions too. So it's important to kind of provide that type of information just for treatment options later on. In terms of how many people are impacted by ADHD, well, I have to say, like, based on the research in the state, about 11% of children are diagnosed with ADHD between the age of 6 to 17. These days, according to the diagnostic criteria, there are two types of ADHD: inattention and hyperactivity and impulsivity. And for some people, they may have like both, so combined type. You will see, in order to diagnose or to look at the symptoms have to be present in multiple settings. So for example, at home or at school, and symptoms have to be present prior to the age of 12. And in younger kids, usually they will start seeing these symptoms before 7.
And I don't know if this is the same for other people in the room, but it's something which has taken prominence since COVID, and people have come out of COVID. Why do you think that is? And do you think some of the lockdown dynamics during COVID has affected students in any way, or do you think it's more just people now having spent more time with their kids, sort of have got to know them a bit better than they would usually have?
That's actually what I was gonna say.
Okay.
That during COVID, students and parents still, that everyone had to stay home, right? So you had a lot more time to observe and see like maybe some challenges. But at the same time, during that time, not just the children but adults as well, it was all new to all of us. Definitely we had a lot to adjust, and we dealt with some stress, right? Because we didn't know what was going on. We didn't know how to actually like handle the situation back then with limited information. Now stress can also like mimic, or those who are stressed and lack or limited social interaction can also like cause some low mood, and with all of this it can impact one's attention span. So I would say like maybe during that time parents started to see more symptoms. They may think like my child can't focus when they're like on the screen trying to learn something, right? There are a lot more distraction at home as well. So they may start to see a lot more symptoms or some behavioral issues, emotional issues. I would say not all of them would have like ADHD. It could be like other factors that can impact their attention span.
So talking of these other factors, I was listening to a podcast recently that they said that children are exposed, in using social media, are exposed to sometimes more than 200 ads an hour. So this is sort of unlike anything we would have experienced on, say, a television or growing up with these types of media. So just understanding about the role of a smartphone in all this. Do smartphones have anything to answer for? Could they be making a situation worse, or is it really just the smartphone is just something which, which is sort of affecting our brains in any other kind of way, which is then maybe starting to manifest a bit like ADHD symptoms? Yeah.
Okay. So there's actually like a study. So this topic has been, people talk about it. There's a lot of debate going on. There's a study in the state again that they follow this group of children for over 2 years, and one is a control group with like limited smartphone or access to like social media, and all of the other group is pretty much just a lot of frequent use of smartphone and looking at social media. And there's no like direct causation, but there's definitely like increased risk of developing ADHD or having like shorter attention span. I don't know if Dr. Pim has anything to add.
I don't know any direct research, but I do agree, because it trains your brain in a different way, because social media, this is like a reward system, right? You get likes, you see posts, you don't like it, you just move on, and the brain is like constantly being triggered, and it adapts the chemical pathways, and so we're trained that, not excited, next, and I think it affects quite a bit in people who are inattentive type in the ADHD, because like they're focusing on tasks, the phone is there, they're distracted, notification, Facebook, whatever. So I think it's certainly related in some way, yeah.
So today we have quite a few people from international schools here, and we'd be interested to understand more about some of the challenges of ADHD in a school setting. What are some of those challenges that you think might impact learners in a school setting?
Yeah, in a school setting. So, for children who may experience or have ADHD, it's really hard for them to, first of all, definitely affects their attention span, right? So in order to learn or reach their potential, it's a lot more challenging. I mean, I do believe that all the children, they all have like capacity, like they're capable of learning. Now, I'm also one of those who personally believe that everyone can reach their potential. But if they have, like, let's say, shorter attention span, difficulty sitting still, that already takes away their opportunity to absorb and retain the information in a classroom. So sometimes when they listen to the teacher, they might not get all the information. When trying to complete a task, they may not know the answer or understand the whole thing, or can't comprehend information just because some pieces are missing. And they don't perform well. They have like lower grades, and teacher or parents may think like, so and so may have like learning issues, and I have to say, like, that can co-occur as well. But all of this is very important to kind of see and understand what's actually going on, and start to like notice some behavioral change, emotional change as well, because not only that, it does not only impact their learning, but it can also impact their self-esteem, their social interaction, making friends, or relationship with parents and teachers.
Actually, I'm gonna add on to that a little bit, because like a lot of the stuff that people think or focus about, like with kids with ADHD, is you're focusing on the objective stuff, meaning the performance at school and those things. But not many people would consider the other side of the equation as an emotional stuff. Because like imagine you're trying to do something, you're trying to do this, you're trying to learn it, focus, you're giving it 100%, but it doesn't work. It just is not working. You cannot encode what you're learning. You cannot focus on the teachers, and that's just the educational side. So when you think about our life, there's other aspects as well, like relationships. Like maybe you can't maintain the relationship with your best friend or even your parents just because you're going off this and that. You told your friend, oh, I'm gonna meet you at this coffee shop at 2 p.m. and then you miss your appointment, you're coming late. And like self-esteem wise, you feel bad about yourself. You don't feel confident. You feel like you're so under-accomplished and all those stuff. So there's like these areas that I'm saying, like a lot of people are not actually considering about. They're just focusing on the educational performance, I would say. And I like you who work in schools to keep in mind about these things as well.
Thanks. Yeah, please come in. You're always welcome. So just you mentioned, you started to touch on how ADHD can affect, say, friendship groups and this kind of thing. How about in the home? I think what strikes me that a very interesting thing is that school is the same for everyone, but everyone has a very unique home and parents or situation. Dr. Pim, I mean, what kind of challenges can ADHD cause in home life, with parents, siblings? And
maybe a lot of quarreling. if you're a parent to like a child or teenage child, you tell them to do something and they said, okay, I'll do it. And then they might forget, they might not complete the task. Even simple stuff like, clean up the room, don't forget to bring this to school, where's the letter? You have to tell them like multiple times, or they're not finishing any task, like finish your homework, but they're not finishing it. And then you're thinking, oh, why are you not listening? Why are you being lazy? A lot of times the parent might like unintentionally blame the child, saying like, oh, lazy, you're so bad, you're not listening to me. But they're just not capable. They're just literally not capable of carrying out that task, because it's the wiring of the brain is different.
I would like to add a little bit there. Yes, with everything that Dr. Pim said, and you asked about the home environment, I think it can be, to be direct, like chaotic and challenging, right? Just pretty much just, yes, being forgetful, or a lot of time parents will tell me like, I tell my kids like, hey, I want you to go upstairs, grab your socks, come back down, put on your shoes, we're getting ready to go to school. Now the kids try to go upstairs and get lost, right? Get distracted by different things and then not coming back. And so, with like being late to school, with time management, not being as organized, I think, and especially for it can be very stressful for parents as well to try to manage everything. And especially if you have like more than one child. So can you imagine? I mean, trying to, but I think, providing structure and all can be very helpful as well.
And now that Dr. J mentioned already about having more than one child, these children get compared so much with their sibling who maybe don't have ADHD, and they're like, look, your sister, brother can do this, why can't you be like them? That's as a person who if you have ADHD, you're gonna feel really bad, like 'cause you feel so like, oh, I can't be like them. I'm the underdogs or
Sure.
stuff like that.
So I wanted to ask this question because frankly, it's kind of an interesting one. I mean, are there any benefits or positives to ADHD? Higher work rate, etc.
I think they're quite happy always, like a lot of them, and their mind are constantly running, so they have like a lot of new ideas. They're carefree, I would say, creative. I have friends who are ADHD and they're super happy, like, oh, look at this, look at that, look at that. Yeah.
I would say the same thing.
Yeah.
They're pretty creative and they
Very creative.
generate ideas. If they can execute the ideas and follow through and complete the task, I think they can be very successful. I mean, if you look up on Google, right, like a lot of businessmen or any like creator,
I would say
they
a lot
say
of
that they
them
do
are
have.
a lot of them are sensitive as well. Would you agree?
Yeah,
Like
yeah.
I think a lot of them are emotionally sensitive as well. I think one of the things is probably not everyone, but a lot of them, they're very like their sensory are heightened, so they would like they would see things that you don't see, or like very sensitive to light, sound, those kind of stuff, as well as emotions. Sometimes they're detect very well how someone is feeling. And
Okay, so I think probably in our minds, what we're thinking of is we're trying to get all the way to the solution and say, well, how can we make life better for these students? But there's a very important piece before that, and I think that's one of the reasons why we're here today, is to discuss, the first steps when someone might require an assessment. If we put ourselves on the school campus, what are the kind of signals or behaviors do we recognize to think, oh, this person might be a candidate for an ADHD assessment? Maybe Dr. Jay.
Yes. So, some cases that might be easier to detect, right? Like you might see like in a classroom setting, you might see like, a child running around, can't sit still, or having some, a lot of children may have like difficulty with emotional regulation as well, So, with like anger issues or any other behavioral issues. So basically, seeing any child who may not be able to like focus or having some issues in other areas in behavior, you might want to kind of either talk to the parents first and see like, is that something that you observe at home as well? Can always like seek professional consultation as well, and not to exclude those who may not have behavioral issues or may not like jump around, walk around. They may be like very quiet, or sometimes may look like they're listening to the teacher, but their mind actually wanders elsewhere, like looking at the window or even like just staring at the whiteboard, for example. So maybe like talk to them. Or another way to also like detect is school performance. I mean, not to be like the only, but that can also help too.
Dr. Pim, how about in the home setting? Anything which parents might want to keep a lookout for that might then suggest that they could benefit from an assessment?
let's say if they're very forgetful, like extremely forgetful, or struggling to complete tasks, like cannot keep up with time management or appointments, if they keep losing stuff, like, if you lose like, I don't know, 10 phones in 1 year, that's not normal, right? I mean, it's not normal. Like, there's all those stuff. And mind you, for the diagnosis for the ADHD, it has to affect the performance. So it's not like this child is, inattentive, but his or her life is completely fine. We can't diagnose them as ADHD. It has to affect your life performance or educational performance somehow. Otherwise, I'm sure like all of us would be.
That's actually like a good point. And yes, that not every kid, or even adults sometimes, not every kids who are happy and active running around
have ADHD.
I think
it's not like that.
Have to also like look at the consistency between multiple settings and how long the symptoms have to be present, and whether the symptoms impact their life in any way.
Right, because we live in the age of self-assessments, which are readily available online, and you know you're able to go as far as diagnosing yourself for almost everything under the sun. But I mean, are there any signs, you know, or behaviors which can send, say, a false signal that teachers or parents actually shouldn't really be worried about? And anything that could come to mind, either of you, to sort of say, actually, this is something you don't need to worry about?
I think school performance is one clear indicator, I would say, because as I mentioned earlier, like it has to affect the performance. So if they're just being active and this and that, but they perform completely okay at school, that might not be something that you need to be too worried about. If their like communication is completely intact with their friends or their parents, and it's fine, like because it has to impair the function somehow. I think.
So now going in, understanding more about the assessment. I mean, what are the real tangible benefits of an assessment? Or obviously, there's peace of mind and this kind of thing, and I think also learning plans and this kind of thing. Could you speak a bit about the benefits of getting a student assessed? Dr. Pim, actually.
Okay. I'll do the brief one and then you can do the detail. So with the assessment, first of all, you can know if the child actually has ADHD or not, because there are a lot of other like coexisting disorders, let's say, that can manifest. So this could be other stuff like anxiety in general that makes them very alert. There could be some hidden depression in there. There can be like defiant disorder. Like there's a lot of stuff that comes out similarly, but not exactly the same. And if the child were to have ADHD, with the assessment, you can tell them, you can tell what type the ADHD is. Like, is it inattentive or is it hyperactive? And once you know the type, or if it's a combination of both, once you know the type, you can adjust like the kids' like learning plan or the lifestyle at home to better suit their style. Let's say if the child is not hyperactive but inattentive, so this type is more prone to like distractions and stuff. So you know that the problem they're having is distraction. It's not about sitting still. And then with the deeper assessment that Dr. J will explain to you later, like you can also test about the how they learn about
So after like the screening to see if you have ADHD and what type of ADHD, to do the more comprehensive evaluation. So for my part, I do like a whole battery that includes intellectual ability. So basically giving the full IQ test to establish that intellectual baseline. I do give tests that look into your verbal and visual memory, processing speed, working memory, attention span, visual, spatial, so all basically like different parts of the brain function. Now, kind of like what I mentioned earlier, that I do believe in a person's reaching their potential, right? Not to say compared to others, but your own potential. Now, to do this kind of test, we can look into strength and the areas that we want to strengthen. It helps provide information into detail because they're all objective paper pencil type of testing. We compare the score to the norms and based on educational level and age. And so for this, we can look at like how this person learns. So for those who have ADHD, let's say, they're capable of learning, but maybe going from A to B, there's so many different ways. At school, they are taught to go this route, let's say, but maybe this kids learn different ways. So this type of evaluation also help kind of point out specific areas as well in order to come up with the diagnostic clarification and treatment and recommendation. And for this, not only to look at the brain function, but I also include like behavioral screening, kind of behavioral issues, any emotional or psychological issues that may exacerbate or impact, or it might just be other conditions like medical that impact attention span. So also basically, it's kind of like you going for physical checkup, but this is for your emotions and your brain. For example, some kids might need extra time to complete tasks or might need a separate room, sitting in a corner, sitting in front of the classroom just so that they have like less distraction or what is
a
it
lot of
called
the-
again? Like the wiggle chair.
There, like a fidget or some
things
stuff
to
like.
fidget. Yeah, so these are, like I said, like all the tests, and there are a lot of different tests that I provide and that I do, and then with all the scores and everything, we can kind of come up with a plan. Yes.
Great. So just so maybe we can now sort of talk practically, like as if we have a case study. So say there's a parent of a student at an international school. They have a chat with their teacher. Okay, it seems like this child could be a good candidate for an assessment. What is the next step? If they were coming to you both, what would that look like? What is the next step?
So for the process, so we start off with giving the questionnaires. Maybe we'll hand out the questionnaires. Do you? So first of all, there are 2 questionnaires that we will send out to you. This is like for free at no charge. So one form is to the parent and the other form is to the teachers. So we're just going to pass it around now. So from these questionnaires, you will be answering about your child. And if the child is already old enough, there is one for the child themselves to complete it as well. So when you answer these questionnaires, you're going to have an idea. If you're answering a lot of yeses, then that's like maybe there is something there, if you're answering a little bit too many yeses than you might think you like, then you can send these questionnaires back to us. And the first step is that the questionnaires will come back to me. I will calculate the scores. We will have an appointment and we will discuss about this. And from this questionnaire, I can have a brief idea if it's ADHD or not. So if it isn't, then it might be something else. I don't know, it could be anxiety, depression, stuff like that. Then it might not go to Dr. J, or it might. But if it's clearly that it's indicative of ADHD, if you have not had a full evaluation, I will recommend you to see Dr. J for a full evaluation of batches. And you do the evaluation and you type up a report.
Yes. So when the case is sent or come to me, I do the comprehensive evaluation, which for that session itself is going to take about like 2 to 3 hours with all of these different tests. Then after that, I'll score everything, write up a report that will have a feedback session with the parents. And so for the teachers, school psychologists, if parents sign a release of information for me to speak with the school personnel, then I can also discuss the results and kind of help come up with the accommodations or additional support from school as well. Yes.
So what are the types of treatment or management pathways available, and where do you guys sit on that approach?
So for treatments, there are many routes, right? Like I would say, like yes, psychotherapy or with the child, with the individual to kind of help manage some of the symptoms with strategies. Again, like if the individual also experience like anxiety, depression, or other stressors, other issues, then that can be done through like therapy. With parents, I can do like consultation, can talk to the parents, and also of course like some cases may need medication management, and that will be
so if Dr. J thinks that the case might need medication, if it's talked and agreed upon, she will send the case back to me. So for medication in kids, I don't actually prescribe. I should not prescribe medication in kids because I'm just a GP. So for the first initial discussion, if I think that the kid actually needs medication, we will be doing like a referral to a psychiatrist. So this will be seen like online. So I will also be in the call. The psychiatrist will be in the call. And with the evaluation, we will see if the psychiatrist recommends the kid to have medication or not. And also with the medication, it's like, it's a very sensitive topic because not everyone need or should have medication. Also, this is something to be discussed between the parents or the psychiatrist, everyone and everything. There are cases in both sides. There are cases where parents usually don't want their child to be on medication, but there are also cases where parents want their child to be on medication, and that I might not agree, or so yeah, there are a lot of possibilities there.
Yeah, when discussing like treatment with parents, I usually try to ask for information and see like what the kids is interested in, right? Like so, kids so young might not do well in like one-on-one psychotherapy, for example. That's not really like their way of learning or engaging, let's say. But there are many other ways, like group therapy, or they can join like activities with other kids, any team group activities for them to learn how to kind of listen to the instruction and learn from others as well. I try to be as creative in terms of recommending or suggesting like different ways. Equine therapy, for example, has become one of the treatment techniques or treatment that people start to look into, things like that. So not necessarily treatments that they can receive from here, but anything that they can explore outside as well.
Mm-hmm. Okay. And in terms of a sort of ADHD, when it is being well managed, what are we then seeing in the child? What are those kind of benefits, I guess? Is it like, oh, this is child is a different person, or is it like what do what does success mean, really?
I think it's different for everyone. It's different for everyone for sure, because it's like the first thing we do is in the consultation is like, what do you want to achieve, right? For some people it might look like academic success. Some people it's about parent-child relationship. It could be that. For some people it's like being on time, appointments. But either way, I think it's just the general quality of life that should improve in the child or in the family and stuff like that. So it's a very subjective thing, but it's not one thing, because it's what you come to us for. It's not just like, oh, the child is smart, we want you to succeed, but maybe that's not the thing that you want. Maybe you just want the child to be happy, to be confident, to
And I think a lot of these schools will see families in transition coming over here. So families coming in from the States or Europe or other countries, and maybe they have received, say, a diagnosis in their home country. Are you also able to take on patients like this?
Yes.
Dr. J?
Yes. So for those who may have, for a child, for any child and adults who have been diagnosed already in the state and need to do re-evaluation, I can do that as well. So basically, we'll need like some information, and then we'll go from there. Yes. So
yes. So in those cases, they don't have to come see me. You don't need to do the questionnaires because you were already like diagnosed. You can go straight to Dr. J if you have to do a re-evaluation. Or in cases if the child is already on medication and needs a re-prescription, then they would come to me.
Okay, so maybe just before we take some questions then, just to sort of wrap this up. So really what we're seeing, the real benefits of getting a child assessed is to really understand that child's learning style, help teachers kind of understand that learning style to then lead to hopefully better outcomes for the child in the classroom. And presumably also helping parents understand their own child. And do you also work with the parents on strategies at home? Is that something that you do, Dr. J?
Yes, that's something that I do as well. So after the evaluation and feedback session, they will come back, and I do provide like services after that. So any follow-ups or any following like sessions, if parents would like to come in and talk and consult about like the next step, like how to manage at home, or like mentioned earlier as well, that if the parents sign a release of information, would like me to talk to the school counselor or the teachers, or other providers, I am here to also help them like throughout this journey.
Great. Okay. Well, thank you very much, both of you. That was, I think, pretty comprehensive all the way from how to identify someone who could benefit from assessment, all the way through to what these assessment looks like, and also the associated costs as well. So thank you for that. We're very happy to take questions from the floor if there are any. We'll also be able to have coffee and a few biscuits outside if you'd rather kind of get into the weeds with one of our experts. But happy to take any questions now if you have any. Okay, that's really bad.
May I know, like, how can we know if that child is just like unorganized or lazy type of person, that they are not ADHD, or all of the unorganized or lazy type of child would be ADHD?
Certainly the first one. So not not every lazy person has ADHD. I'm pretty sure there are people out there who are just basically lazy. So like I said, I think you have to observe the patterns, the trend, that it has to occur across multiple settings. Like not that they're just lazy just at home, right? It has to be in many aspects of life, like at school, at home. Like I said, there has to be an impaired function. So it's not. They have to be like so lazy that they're struggling at school, or they're missing work, or they're having relationship problems with their friends, or for example. So I think it's about the pattern. Do you want to add something to that?
Add to that,
Mm-hmm.
and we'll use the same line there. But there's also genetic components, So not to say that every child who's, let's say, not to say that if parents have ADHD, the child will have ADHD. It's not that, but you can also kind of, gauge and you may wonder, like, how do I know if, like, what if parents also don't know, right? But kind of observe and see like similar, maybe like some characteristics or some symptoms or some challenges that they may have, that can be helpful, and always kind of check in, and you can seek help. But Dr. Pim, I would agree with Dr. Pim in terms of if that start to impact the individual, the child in any way in life, maybe just being disorganized, not organized, that one thing, but ones that start to impact their school or just family function.
And this, let's talk a little bit about impact. This can progress in life, as in like when they were younger, maybe it's okay for them to cope with stuff, there's no issues. But when you get older, maybe like junior high school or high school, when tasks become more demanding, when you have to be more organized in your life, you need to complete tasks, this can have a greater effect, and things might collapse, it might show up. But in saying this, there's also similar possibilities other way around, meaning there's an issue when it's like younger, but then people can also grow out of it. So like people eventually find a coping mechanism for themselves. So not everyone with ADHD obviously needs medication or treatment, because eventually some people just find their own solution, and they somehow manage to.
So they learn to compensate, and also the severity as well, right? Like once you're older, you start to learn some strategies. Then as long as you have your way to cope and deal and manage, I would say, with the symptoms. If it's not affecting life in any way, then a lot of people,
it's fine, like live with it.
I'd like to ask about your diagnostic test. I see that you sent out this one questionnaire available. Is that your main tools for diagnostic, or you have other tools that you're using? The next question is that after diagnostic, do you normally send to Dr. J to do other battery tests, and what are other test battery Dr. J uses?
Maybe we're talking about the diagnosis for ADHD, correct?
Yes.
Okay, so this questionnaire certainly is not the diagnosis for ADHD. This is only just the screening. This is just a screening, and in this questionnaire, it has questions regarding ADHD, regarding depression, anxiety, and other disorder. So this is just purely screening. It cannot diagnose anything, any disease. So if the score is high, then we send, I would refer the case to Dr. J. This is where she does the diagnosis, and you can talk about the...
So I use like different batteries there, but the main one that I usually use is for the IQ test, I use like the WISC or the WAIS based on like their age, right? For achievement, I use like Kaufman, the latest version, third version. I do put in RAMO, sorry, I'm blanking on it. So RAMO, like the wide range of memory tests. So a lot of time I'll use sub-tests, use only the test that will give me the information. Then I throw in auditory processing, continuous processing to look at their auditory attention span. Then
the back as well, right?
trail A and B to look at their visual spatial processing. I also throw in additional self-report or parents report that look into like anxiety, other behavioral issues, aggression scale, all of that to kind of look at this person as a whole. So not just the intellectual, the cognitive functions, but also like additional emotional, behavioral, any other psychological issues that may play a role as well.
It's super comprehensive. Like these are batteries of stuff, and Dr. J has this huge box of equipment, which will be they're like what blocks and pictures, images, a lot of stuff that she will run through with the child.
Would you ever do that on the campus of the school, or is there a special space that you would do it in? How might that work?
With that evaluation, right? So it will be here, in person. For any cases, let's say if there's, for some reason, would like me to go out to the school and observe the child behavior in a classroom setting first, or to maybe like arrange something to have me going out there and do the test there, that can also be arranged, and we can discuss that. Yeah, pretty open to any arrangement.
Right.
Are you doing the ADOS at all? Do any autism testing?
Oh, that's a good question. So I don't do full evaluation for autism just because they have like separate set of batteries. But I do give screening, so more like questionnaires, talking to the parents. And yes, actually, thank you for mentioning autism, because symptoms can overlap and they can be very challenging to distinguish as well. But I do only give like the screening, and if I detect based on like some of the neuropsych battery that I give, if there's anything that might seem to also link to autism, then I will put the as like professional, let's look more into this, or refer. Yeah. Yes.
I'm a school psychologist at one of our international schools, and we provide very similar test batteries or the same test batteries and evaluations. And we're really looking to partner with more providers for the next step after we've provided the evaluation, because we have a lot of parents who are wanting a clinical diagnosis and they want to know what their outside treatment options are. Do you ever partner with school psychologists if an evaluation has already been completed and shared with you?
So that can also be another route or another option as well, where the whole evaluation is already completed. Then my part will, will look into like the scores and interpretation and all of that, and come up with a diagnostic clarification, right, and treatment recommendation. So in that sense, that's something that, let's say if that's the case and parents bring in the report, or I talk to the school psychologist, then we'll go from there and see like, okay, kind of have that collaboration where we discuss about the results together, and then, I'll provide like, the diagnosis, I would say. Yeah. One thing I want to say, yes, it will never, and it can as well, be the case where the kids just recently received like the whole evaluation, come here and have to do again, because it cannot be repeated. That's one thing. And also another thing is, they don't want to go through another 3 hours. So that's something that we can do as well. Like, and I have to say, like, I've done that before, where school psychologists complete it, or sometimes they complete certain part of the evaluation. And when I look at, let's say, if anything has to be added, then I'll discuss and say like, maybe we'll look into more of this area as well. Then I might add something, but it will never be something redundant.
Great, thank you. Can I ask two other quick follow-up questions? What is your timeline for if we were to refer a parent to you and they already have an evaluation that was completed by the school? Can you tell us a little bit about your intake process and timeline? Do you have a long wait list?
Currently, there's no like wait list or
You get a
it's
week.
pretty-
Or
yes. So basically, if the parents like reach out to us, can definitely ACE will help provide the time slot and everything, and after that we'll be able to just get that process going. Yes.
Great, thank you. And then just lastly, the age ranges that you cover for children, are they?
For assessment, I start at 6 and above, 6 years old and above.
Okay, yes, thank you.
So I have so I'm an early years teacher, so I work 4 to 5 year olds, 5 to 6 year olds, so it's like right on that cusp before you would do an assessment.
Yes.
And I know sometimes it's okay, they'll grow out of
Mm-hmm.
these signs maybe, but then I've definitely been in a position where either they've just been diagnosed or looking at your questionnaire there would be a lot of ticks. Would you have advice? And for me it's a lot of adapting, learning, a lot of observation, seeing what works, doesn't work. Would you have advice of how to kind of present to a parent like, I think your child is showing a lot of signs, symptoms for ADHD. So I was kind of in this position last year, and then they ended up, or 2 years ago, then they ended up moving back to America, got diagnosed, but I was kind of the first person to, I guess, say something.
Mm-hmm.
And I guess from a professional side, is there advice? I know that's kind of a very generic question, but how to speak to parents about obviously a very sensitive topic. And then there's, like you said, there's speaking to Thai parents, and then there's speaking to American parents.
And maybe if I could just add to this, because I think Sammy's brought up a good point, but it's also the fact that what I've noticed is that some parents are a bit sensitive about having an official document produced with this is the diagnosis, because they're worried that when the child goes to the next school, it might count against them, right? That, oh, sorry, we
there's that
can't
side
support your kid
as
because,
well.
yeah. So I also add that I think it's quite a big problem.
Yes. So to me, I think always present in a way that you talk about like the positive things first, right? I mean, of course, like you see the child and you're worried and you're concerned. First of all, you see that the child has the child is capable of learning. You see the potential. You see that the child can master in many different areas. At the same time, you start to notice that some of the behaviors or emotional issues quite prevent them from going even further. And I think especially for parents in general, they would like to help their child to succeed. And so to kind of present in this way, I would say help them understand that you see a lot of potential in the child, but these are the areas that you would like to address, just so that if parents observe the same behavior or issues or at home, then kind of like we're here to help, right? Because I think kids spend a lot of time at school. I mean, and I would say like teachers, a lot of time I think teachers see more symptoms than parents, and of course parents, they love their child, right? Not to say So it's hard for them to kind of like see or pinpoint that this is problematic, but and even like behavioral chart or something to kind of present and let them know like we kind of have this system in the classroom and for all the kids, and seems like so and so has not been doing well in this area and all of that. Yeah.
Do you take, like, is 6 the point?
The
or-
reason I said 6 for evaluation is because the test that I give, like norm starts at 6,
Yeah.
but prior to 6, I can do like consultation with parents. I can also provide them like, some behavioral scales that are normed as well. So anything that is not like the actual paper pencil
Yeah,
type
just
of
some
testing,
guidance
yeah,
to-
I can still do some type of testing for them, but mainly more like reports from parents compared to the norms and all of that, and can kind of sit down and talk about like, there's signs that your child might be experiencing this, and, kind of recommend to observe and keep checking and see if this continues. But yeah, it can be very challenging, but I think letting the parents know, because even I myself, from my experience, sitting down trying to give the feedback and tell the parents that, hey, so, turns out that from the results, yes, seems like ADHD is the diagnosis. It can be very difficult. 2 ways. Some parents, some individuals might feel relieved knowing that, there's actually something that I'm experiencing that really prevent me from doing as well as I would like to. And then the other part can be like, I don't want to have the diagnosis. But either way, I think help them understand that it's okay to at least like seek some consultation and understand a little bit better. And the whole intention is to help your child succeed and be well.
I'm gonna add on to that a little bit. I think for the parents, well, we're talking about, so you were talking about Western and Thai parents, right? Just gonna inform something about the Thai perspective. I'm not sure if you're aware, but the ADHD word in Thai has a negative connotation in itself, because the way we call ADHD in Thai is like short span attention. This is the literal name in Thai. So no parent would want their child to be called, oh, he has short span attention. It does not sound nice. It does not sound nice at all in Thai. So realistically speaking, this is where we have to see where the child is, and as soon as the parent understand this, they can make the best decision for him, herself, and the
I'm sure there are
child.
schools here that actually will use this as part of their individual learning plan. Is there anyone here that might want to speak to that, open up to the floor a little bit to share what your school does with this kind of assessment?
Well, I can speak as a parent of a student that was diagnosed prior to coming to school here in Thailand. He had his diagnosis prior and then continued, so his learning plan was adapted based on his diagnosis. But then as he went to university, the school does natural assessments and as part of just the process that they do from their learning support, that diagnosis then needed to be attached with his final assessment as he did apply for university, because that needed to be part of his university applications so that the schools could review and those accommodations then followed with him, especially with I think it's the SAT board for standardized testing and exams, and also IB. He had to have those diagnoses in his official plan so that those accommodations were also valid for when he took SATs and when he did his IB exams. So that then has followed him, and his accommodations were immediately rolled in, whether he was on medication or whatever treatment they were doing. The assessment and the diagnosis stayed with his file, so it moved with him through university.
I think what strikes me about schools is that it's a continuum. It's a track. You can't press pause, and like we can as an adult, and we can get to it maybe next month when things calm down a bit. School, you have these milestones you constantly have to be hitting. The exam times and so maybe Sammy, I guess the amount of money that parents are paying for this education as well. Certainly in Thailand, it's not cheap to have your child privately educated here. It's making sure that really the kids are hitting these milestones, that they're keeping the train on the rails, and ultimately don't have to redo exams or redo years, and also just making sure that if a child continues to learn, you're getting the most out of that education and that investment that you're putting into these schools, usually across 15 years. So I think there's a real kind of, I'm not a medical expert, but there's a real, financial cost to a student not hitting those milestones, and if an assessment will get them closer to that, and the school will give them better, greater accommodations in exams or an individual learning plan, it's you can start to realize that financial investment that these parents are making. So you can always appeal to the to the financial side, I guess.
But the intellectual investment is huge. My son was diagnosed early and had a history, so we made sure to do that. And with that early diagnosis, we tried a lot of different things. We went through the whole gamut of changing things at home, and a lot of those things worked. But as school became adapting and different challenges, getting him that support early on so that he was building those skills with and learning to advocate for himself and learning what his accommodations were, teaching him how to utilize those so that when he did get to high school and was in the IB program and was doing all of that, he had already learned those skills that his doctor had worked with him and how to manage those things and the medication, which levels, so that he was ready. So the cost to us was more his intellectual capabilities early to learn how to live and move forward with something.
Advocate for himself, which is I
Stick
think is
with
a
it
really
forever,
important
right?
point. Yeah. Okay. As I said, we're going to have some time outside, time for coffee and there's plenty of biscuits that haven't been eaten yet. I know some of you have to go back and teach, so I'm aware of your time. But I think just the last thing I'll say is that, HealthDeliver, the reason that we're sitting here today is because members of the international school community came to us and said, this is an issue, please can you help us? And so even if what you've heard today is not necessarily relevant to a challenge that you have in the future, you can still contact us, ask us, how do you have an expert in this field? This is an issue for us. Could you look to do an event around this kind of issue or that issue? I think the unique thing about this organization is that we just we have this space, and Dean has created a space here and a platform to get people together to talk about these things, to then help you guys, and also to help network with each other, because we're as strong as our network. So yeah, thank you all for coming here today and being part of this network. And as I said, please just in future, any questions you have, you can email Ace, you can email anyone from HealthDeliver, and it'll get picked up immediately. So thank you very much, and look forward to seeing you at the next one.